Today's revised spending plan is a departure from January's projections that saw the state's budget mostly balanced. Now, Newsom says California is facing a $12 billion deficit due to what he calls economic uncertainty, including the president's changing tariff policies and a volatile stock market. The governor says that could reduce the state's revenues by $16 billion in the coming years.
California is under assault. The United States of America, in many respects, is under assault because we have a president that's been reckless in terms of assaulting those growth engines. Best to describe this as a Trump slump all across the United States. It's reflected in adjustments by every independent economist, by leading banks.
One Republican senator called it the Gavin gap. To balance the budget, the governor is proposing freezing enrollment in state-funded health care for undocumented immigrants.
Just a year ago, that Governor Newsom granted Medi-Cal access to low-income immigrants without legal status. That program now being scaled back. Fox 7's Christina Gonzalez live in the Westlake District at a community clinic where people there are worried they depend on this. Christina.
Yeah, they do. A lot of people do. But, you know, when the program started, it was supposed to cost about $3 billion a year, and that ballooned to $11 billion last year. So the governor is freezing new entries into it and making those, or asking those people who are already in it to pay. Take a look. A rally to protect Medicaid in Los Angeles, part of a statewide day of action rejecting cuts to Medi-Cal, which covers 15 million Californians, including 1.6 million undocumented immigrants. Medi-Cal covered my pregnancy, says one client heading into the Romero Clinic on Alvarado Street. With 6 locations, the Romero system provides health care for 20,000 people, regardless of their ability to pay or immigration status. But now, many people are worried.
We're not cutting or rolling back those that are enrolled in our Medi-Cal system. We're just capping it, particularly for those without documentation.
Governor Newsom just announced that Medi-Cal will stop covering undocumented immigrants for free. The cost will be $100 a month for adults. I thought the governor supported immigrants, she says, echoing many others in the waiting room. But one patient outside thinks it's not necessarily a bad idea. She supports the fact that under the governor's proposal, children could still enroll even after the January 2026 deadline. After that, all undocumented immigrants will still be covered for emergencies. But those who don't enroll before January will be uncovered for expenses like prescription drugs and doctor's visits.
We're not being treated fairly.
This American-born citizen who we helped to the eye clinic says no one should be struggling to get medical help.
I'm trying to get my eyes under wraps so that I can be able to see and advocate for myself better.
And you think he should also be helping undocumented immigrants? That assistance should also continue medical?
Yes, they should still help them because they need help.
But they are saying that stopping or freezing the new enrollment of undocumented immigrants in the program will save the state at least $5 billion.